Welcome to Doc Talk Diaries. In this video, I'll be talking about incised wound, chop wound, and defense wounds. What are incised wound? Incised wound is an injury that is caused by sharp cutting edge weapons. What are sharp cutting edge weapons? It might be knife, razor, scalpel. It is a clean cut through the tissue. It is mainly produced by pressure and friction over a very narrow area. So let's discuss the mechanism of incised wound. As we are seeing in the picture, the knife is producing striking effect over the surface of the skin. So what kind of wound is produced? Incised wound is formed. How to differentiate between incised wound and a lacerated wound? The incised wound has got spindle shape. The length of the wound is more compared to the width of the wound. The margins are clearly cut. The depth of the wound indicates the degree of penetration. It has got head, hand, and it has got tailing. Whereas in lacerated wound, since it is caused by a sharp weapon, the margins are irregular. Hemorrhage is less in lacerated wound, but in case of incised wound, hemorrhage is more. Why it is more, I'll tell you later. In the third picture, as you are seeing, the knife is producing sawing effect over the surface of the skin. So multiple incised wound can be formed. What are the features of incised wound? The incised wound has got a clean margin. These are the clean margins. It is not irregular. It is regular margin. The deeper tissue are clean cut in the same plane. Vessels and nerves are cleanly cut. So these are the features of incised wound. What are the characteristics of incised wound? They are clean cut, well defined and everted. The width is greater than the edge of the weapon. Length is greater than the width and the depth. Hemorrhage is more. Why? Why? Because vessels like artery and vein is cut. That's why hemorrhage is more. Direction. They are deeper at beginning. Why they are deeper at beginning? Why? Because more pressure is exerted on knife at this point. That point is termed as head of wound. And at the end of the cut, the wound is shallow. This is known as tailing of the wound. In this diagram, you can see that this part is head end, this part is tailing, and between head end and tailing, you can also see the wound is gaping. Near head end, the wound is more deeper, whereas near the tailing end, the wound is shallower. What are the medico-legal importance? By looking at the incised wound, what will you determine? You can determine the cause of injury. You can determine the nature of injury, whether the injury is simple or whether the injury is grievous. You can determine the age of injury, and you can also determine the injury whether it is accidental or the injury is caused by suicidal or the injury is an homicidal. Accidental, suicidal and homicidal. So what are the four medico-legal importance of incised wound? You can know the cause of injury, you can know the nature of injury, you can determine the age of injury, and you can also know whether the injury is accidental or whether the injury is suicidal or it is homicidal. These are the medico-legal importance of incised wound. The next topic is chop wound. What is chop wound? It is mainly produced by heavy weapons like axe, butchers, knife, etc. See, in this picture you can see, so this is chop wound. The margins are regular, but they are deep gaping wounds. The depth of the wound is more. So they are chopping wounds or chop wounds. Medico-legal importance. By looking at the chop wound, what will you determine? Chop wounds are usually homicidal in nature. However, accidental injuries may be sustained by a person working in factories, etc. See that means chop wounds are always homicidal. Why? Because the person who is causing injury to the victim has always an intention. So it is homicidal. In case of accidental injuries, the person who is working in factories, so he can be injured by a heavy machines. From the heel or toe end, the relative position of the assailant and the victim can be known. You can also determine the type of the weapons. You can determine the relative position of the assailant and the victim. The age of the injury can be known. So these are some of the medical legal importance of chop wound. What are defense wound? Defense wound is nothing but a victim tries to save himself. Either he will raise his arm or he will grasp the weapon to prevent the attack. So that is called as defense wound. So there are two types, passive defense wound and active defense wound. What is passive defense wound and what is active defense wound? In the first picture that you are seeing, this is active defense, and in the second picture that you are seeing is this is passive defense. In active defense, the person tries to grasp the weapons such that he can get injuries over the palm, fingers and over interdigital areas. Likewise, in case of passive defense, what happens? The victim tries to escape from the assailant, whoever is causing harm. So the injuries may be over the dorsal surface of forearm, over palm and over fingers also. So this is termed as defense wound. Next type of wound is self-inflicted and fabricated wounds. What is self-inflicted wounds? They are the wounds that are produced by a person on his body. A person will cause injury to his own body. Why? Because he might be psychologically ill, he might be depressed. That's why he'll cause injury to himself. So that is called a self-inflicted wound. Fabricated wound. In fabricated wound, what happens is that the person will ask another person to cause injury with his consent, or he will cause injury to himself. So that is called as fabricated wound. So what is fabricated wound? They are the wounds which may be produced by a person on his own body or by another with his consent. So that is called as fabricated wound. You can see these are some of the fabricated wounds. So that's all in this video. Thank you so much and keep supporting.